Hey everybody, my name is Dr. Scott Giacomucci. I'm the director and founder of the Phoenix Center for Experiential Trauma Therapy in Media, Pennsylvania. And today I wanted to talk to you about two mental health disorders that share a lot of overlap: complex post-traumatic stress disorder, or CPTSD, and borderline personality disorder, or BPD. So in this video, I'm going to talk about some of the similarities in presentation and root causes and treatment, as well as some of the differences in root causes, presentation, and treatment. So, first of all, I want to say there's a ton of overlap, and both of these are highly misunderstood diagnoses. In many ways, they both come back to early relational trauma, and in many ways, they both manifest in really difficulty with relationships today, stress, negative beliefs about self, difficulty with self-image. And so there's a lot of overlap. They're often confused for each other. Borderline personality disorder historically was much better or much more well-known than CPTSD, which is a much newer diagnosis and hasn't even been fully recognized by the professional community, especially in the United States. So more times than not, especially in the past, borderline personality disorder was misdiagnosed when it could have been complex PTSD. But there's another video I made about the politics and differences of CPTSD and why it isn't recognized fully as a diagnosis. So we won't get into that here. But what is complex PTSD or CPTSD? Complex PTSD is a result of complex trauma, which is when we experience reoccurring experiences of adversity again and again and again and again. So an example of this would be ongoing experiences of violence or abuse or really severe bullying or racism. These are things that would lead to prolonged states of stress over time. CPTSD is not a personality disorder. Instead, CPTSD is a trauma response. It's a trauma disorder. It results because of the trauma. So CPTSD and borderline personality disorder are in different categories altogether. The symptoms of CPTSD are rooted in disorganized self-organization or disruptions in self-organization, hypervigilance, flashbacks, avoidance and dissociation, difficulty with emotions, difficulty with relationships, and a persistent negative view of self. So there's often deep-seated shame or self-blame with CPTSD. So on the other hand, borderline personality disorder is characterized by really extreme emotional sensitivity, an unstable self-image, and an intense fear of abandonment. There's this kind of push and pull in relationships. One minute we feel like the other person is the best therapist in the world, and then the next week we feel like they're the worst therapist in the world. And so there's this really inconsistent experience in relationships. And that's really what characterizes borderline personality disorder. Unstable relationships, difficulty with identity, and impulsivity. So while CPTSD, there's a consistent negative self-image. In borderline personality disorder, there's an unstable self-image. So our experience of self shifts from positive to neutral to negative to positive to negative to positive to negative. Whereas in CPTSD, our sense of self is flat and consistently negative. Borderline personality disorder is often a result of early attachment trauma, neglect, and chaotic family dynamics. So if we grow up and our caregivers are really inconsistent, one minute they're nurturing and loving and warm and providing, and the next minute they're traumatizing or they're gone. It really creates this template for relationships where there's real inconsistency, instability, lots of up and downs, and that carries with us throughout the rest of our lives. So these are some of the key symptoms of borderline personality disorder: an intense fear of abandonment, which often leads to really extreme behaviors to try to avoid the abandonment or avoid the rejection. Many times this just makes it worse or even more inevitable that we are going to end up feeling abandoned or rejected. Really rapid mood swings often being triggered by minor events. Like I talked about earlier, borderline is characterized by an unstable self-identity, feeling like a different person depending on the situation or depending on the relationship. Really intense black and white thinking, like all or nothing thinking. Someone's all good or all bad. I'm all good or all bad. And really impulsive or self-destructive behaviors like reckless spending, self-harm, or substance abuse. There's definitely a lot of overlap here with CPTSD and borderline personality disorder. On some level, we could think of both as simply the result of intense relational trauma, usually in childhood. So they really share that in common. They both involve difficulty with emotions, difficulty with relationships and trust, dissociation, feeling disconnected and detached, self-blame, shame, and that core history of relational trauma. But there are some key, subtle, but major ways that they're different from each other. And I feel like these often get missed. While CPTSD is a result of prolonged and reoccurring trauma, which might be relational, might be abuse, neglect, war, domestic violence, so on. Borderline personality disorder is usually a result of early attachment trauma and chaotic relationships in families and caregivers. So there's lots of overlap even there in the common causes of both disorders, and some differences. The core struggle of CPTSD relates to hypervigilance and shame and flashbacks and difficulty in relationships and emotions and really negative view of self. Whereas the core struggle in borderline personality disorder is this intense fear of abandonment and instability with a sense of self and a really dramatic or intense push and pull dynamics in relationships that really crave to be in a close relationship and I want to be close, and then later rejecting the other person, being afraid of the closeness or feeling like the other person's going to hurt me and I need to push them away. So this push and pull dynamic is most characterized by borderline personality disorder. Similar dynamics emerge for folks struggling with CPTSD. But with CPTSD in relationships, it tends to be more avoidance or more hyperarousal and hypervigilance or being triggered by things that happen in the relationships, like being triggered by physical touch or being triggered by sex or being triggered by things that the other person says or does or doesn't say or doesn't do. So there's some core differences here, even in the relational components of CPTSD and borderline personality disorder. Now, when it comes to self-image, there's also some core subtle difference that CPTSD is characterized by that consistent negative sense of self, constantly feeling like I'm unworthy, constantly feeling like I'm a failure, constantly feeling like I'm worthless or feeling insecure, really negative view of self-hatred, self-criticism, feeling down about ourselves. Whereas borderline personality disorder has a fluid and fluctuating sense of self that at one point someone with experiencing BPD symptoms might feel really good about themselves and feel like they're strong and competent and capable and confident. And then the next day they might feel really down on themselves, feel like they're worthless and not good enough. So there's a lot of similarity, but CPTSD is more consistently negative, whereas borderline tends to go up and down, both the sense of self and the experience in relationships. Now, in terms of reactions to stress, CPTSD is more characterized by freeze responses, dissociation, numbness, detachment, or like being in a state of hyperarousal, like overactive. Nervous system is overactive. Whereas borderline personality disorder, when it comes to stress and emotions, is a lot more up and down. There's lots of difficulty regulating emotions, impulsivity, really intense shifts in emotions, really high, really low. And so this is another key difference between CPTSD and borderline personality disorder. Now, the focus of healing is also different for CPTSD and for borderline personality disorder. In CPTSD, the focus of healing ends up being more focused on healing the trauma, processing the trauma, desensitizing the triggers, establishing safety, finding ways to regulate the nervous system. Whereas the treatment for borderline personality disorder tends to be more focused on emotional regulation, boundary setting, and stabilizing a sense of self. So all of these treatment and healing focuses for borderline personality disorder can also show up in in healing for CPTSD and vice versa, but the overall focus of the treatment tends to be slightly different. Now, many people experience both CPTSD and borderline personality disorder at the same time, and that's certainly possible. Probably even more frequently, people will experience some aspects of CPTSD and some aspects of BPD at the same time, because prolonged trauma is the cause of both, and it can impact us in both ways. So when we're experiencing both at the same time, then the focus of healing needs to include all those different themes, and the treatment needs to really address both the CPTSD symptoms and causes as well as the BPD symptoms and causes. So in finding the right treatment, finding the right support, the recommended treatments are slightly different. The most recommended treatment for borderline personality disorder is called DBT therapy, or dialectical behavioral therapy. And DBT is highly effective for the treatment of borderline personality disorder in that it's really focused on challenging black and white thinking, providing lots of coping skills for emotional regulation, and really emphasizes relational stability. Whereas CPTSD, the treatments end up being more trauma-focused treatments such as EMDR or somatic psychotherapies or internal family systems therapies or psychodrama or CBT even. And the focus ends up being more on processing the past trauma after safety's been established here and now. So if somebody's experiencing both, then it might be wise to integrate both treatments or to engage in both treatments simultaneously. Regardless of whether somebody's experiencing CPTSD or borderline personality disorder, healing is possible, and it's possible to recover from both experiences, both disorders. I've seen people do it in my clinical practice on a pretty regular basis. So know that there's hope, and that both of these don't have to be lifelong experiences, that we can cope with them, we can learn to live with them, we can heal from the causes of them, and we can change who we are going forward. It's possible to recover. So if you struggled with CPTSD or borderline personality disorder or both, I encourage you to write in the comments what you found helpful in terms of healing and finding the right support. What's worked for you? If you found the video useful, I encourage you to subscribe to the channel. That way you'll get notified when future videos are posted and released. Thanks, everyone.